Hello, and welcome to episode 31 of the Asthma Spotlight podcast. In today's podcast, I'm going to talk about how asthma drugs get into your lungs, that is, to the place where they work. Now, there are three important things that people with asthma should know about inhalers and inhalation medication that's used for treating asthma. Of course, these are also relevant for those who care for people with asthma, as well as for people with asthma and parents of children who have asthma. So the three things I'm going to talk about today are about inhaler technique, and that's the way that you use your inhaler. Second, I'll talk about spacer devices, which are used together with pressurized meter-dose inhalers. And then finally, I'll talk about nebulisers and some practical pointers about the use of nebulisers. So starting with inhaler technique, first a bit of background. You may be interested to know that the ancient Egyptians used a form of inhaled medication 3,500 years ago. They used to place a herb on hot rock with a bit of water to create fumes that could be inhaled by people having breathing problems. Another interesting historical fact is that the first inhaler, which was used for cough, was invented by a physician in Devon in the southwest of England, and his name was John Mudge. He was a specialist physician. Now, more recently, after the first pressurized inhaler was developed by Riker Laboratories in 1957 in Philadelphia, over the last 70 years, major advances have been made in the development of inhalers which are used for lung diseases such as asthma and chronic obstructive pulmonary disease. So much of the treatment of asthma is by medication that's inhaled, and it's logical, therefore, that the drug needs to get into your lungs in order to work properly. So if you're not using the correct technique for your inhaler, the drug cannot possibly work. So there are three kinds of inhalers. There's the pressurized meter-dose inhalers, which are the common ones that you know about, which you press to release the drug. When you press these devices, an aerosol comes out so you can inhale that. The second kind are the dry powder devices. And the third kind of inhaler are called the soft mist inhalers. If you listened to my interview with Gary MacDonald, pharmacist, in episode 25, you will have heard his excellent description of how to use an inhaler. And this description was the method used in doing asthma reviews over the telephone during the COVID pandemic, when face-to-face asthma reviews were not possible. Have a listen to that episode if you haven't yet. Now, Gary did acknowledge that this system for explaining inhaler preparation and use had been developed by his colleague Anna Murphy, who is also a specialist pharmacist with an interest in asthma. As I said, it's very important, no matter what inhaler you have, is that you can use your inhaler correctly. That's important because one of the risk factors for poor asthma outcome is poor inhaler technique. So the most dangerous thing that can happen if you're not using your inhaler correctly is that you could have an asthma attack. So what can you do about this? First, there are instructions inside the box that comes with each new inhaler that you get. So make sure you read through these instructions, which will include preparing the device for use, using it, and how to store it safely. So when you're prescribed an inhaler, usually someone will have shown you how to use it, and ideally you should have been checked to see that you can use it correctly. The other important thing to know is that your inhaler technique should be checked frequently, because many people lose the ability to use the device correctly, so you forget over time and you get into bad habits. In fact, based on research findings, it is helpful to have your inhaler technique checked whenever your asthma flares up, and most importantly, after you've had an attack. So currently, many healthcare professionals in the UK and possibly in other countries are being encouraged to change your inhaler for various reasons. What's important is that if your inhaler has been changed, and sometimes this might be done remotely without you being present, so your prescription might change and you might only discover that you've got a new inhaler when you go to the pharmacist to collect it. So if your technique has not been checked, you obviously won't be able to use that device correctly. So if you've been prescribed a new device, you need to make sure that you ask someone who knows how to do so to teach you how to use the new inhaler. Now, of course, there are videos on how to do this. However, it's much more important that somebody who's trained to check you watches you and decides whether you're using your inhaler correctly or not. Because if you aren't, you might need another prescription for a different kind of inhaler, or you might need a spacer to use together with your inhaler. And I'll talk about spacers in a moment. Another thing that might be helpful if you're prescribed a new inhaler is for you to check your asthma control for a few months so that you can see whether this new inhaler is helping you or not. If you're not sure how to check your asthma control, I suggest listen to my Asthma Spotlight podcasts number 6 and 7 on how to do this. Now, the last point on inhalers that I want to share about inhaler devices is that you should always make sure you've got a spare inhaler if you travel. And if you fly, it's important to keep these with you inside the aeroplane and not with your packed luggage, so that you're always sure that you've got your asthma medication available. So next we talk about spacer devices. And spacer inhaler devices are tubes that are usually made from plastic. These come in many different shapes and sizes and are used together with pressurized meter-dose inhalers that work with the pressurized gas. These are the so-called fluorinated or F gases, which I'll talk about in another podcast. This type of inhaler, the kind that you press to release an aerosol, are the commonest kind of inhalers that are used worldwide, and they're not easy to use correctly. The problem is that you have to coordinate pressing the device to actuate it, which produces the drug in an aerosol spray, and almost at the same time, you need to then breathe the drug in, and in addition, you need to breathe it in slowly, and slowly means that you take approximately 5 seconds to breathe in. So as a result, the need to combine and time these things correctly results in many people not being able to use these pressurized inhalers correctly. So that's why spacers are prescribed for most children and some older people who have problems either with manual dexterity or with timing their inhalation correctly. Now the spacer, this plastic chamber, has an opening at one end for you to stick your inhaler into and a mouthpiece or a mask at the other end for you to breathe in from. So if you have been prescribed a spacer, make sure that you're shown how to use it and also that your technique is checked by someone trained to do so. So now, because it's easy to use a spacer, this is one of the ways that emergency reliever medication, that's the short-acting reliever called salbutamol or albuterol, is used instead of trying to use the inhaler on its own. Research studies have shown that using a spacer with salbutamol is an effective way to treat asthma attacks that are not severe, and this may be included in your self-management plan. So in addition to knowing how to use a spacer that you or your child have been prescribed, there are two important things that you should know. One is to do with static electricity. That's the sparks that fly when you put on a woolen jersey, which has been left for a while. And the other is to do with masks. Clearly, as with any medical device, you should read the instructions that come with your spacer. In most cases, spacers are susceptible to static electricity, and as a result, when an asthma drug is sprayed into the spacer, the drug can then stick to the inside of the spacer, and so you won't get much effect from the drug yourself. So when you first get your spacer, you should follow the instructions in the leaflet, and this will usually include washing it with warm soapy water and then leaving it to dry in the air. The important message is that you must not dry the spacer with a cloth, because that action of drying or rubbing the spacer with a cloth increases the electric charge and the static electricity, which causes the drug to stick to it. So what you should do after washing it, and you should follow the instructions, which will usually say that you should wash it at least once a week, you should leave it to stand to dry alone in the air. Don't wipe it dry. Now, the other important thing about spacers relates to masks. The masks are useful in young children where a parent or a carer can assist the child in taking inhaled medication. Now, unfortunately, if you're using a mask, some of the drug can deposit on the area around the mouth and nose when the child's using it to inhale. And so you should wash the child's face after using a steroid inhaler to get rid of any excess drug on his face. But in general, the masks should not be used in children over the age of 3, when they should be changed to a spacer with a mouthpiece. So if your child is using a spacer with a mask and your child is older than 3 years old, it would be useful to ask your doctor whether you could have a prescription for one with a mouthpiece instead. And most young children are able to use these spacers with a mouthpiece. The last topic today that I'm going to talk about is nebulisers. Now, in asthma, nebulizers are usually used in emergencies for treating asthma attacks. Now, nebulizers are devices that very cleverly convert a liquid medicine into an aerosol or a gas so that it can be inhaled easily. The actual nebulizer is a small plastic container with a thin tube inside it which converts the liquid into a gas when air is pressed through it at high pressure. So the liquid medicine that's used most frequently in a nebulizer is called salbutamol, which is also known as albuterol in some countries. And then by attaching one end of the nebulizer to an oxygen or an air supply that is driven at pressure, and the other end to a mask or a mouthpiece, or small tubes which are placed inside the nostrils so you can breathe the medicine in. In hospitals and some primary care centres, nebulized medicine is usually driven by compressed oxygen, so it's piped from the wall. In primary care and in some emergency departments, the nebulizers are driven by air compressors or pumps that push air through the tubes to the nebulizer to generate the aerosol plume in order that you can breathe it in. Ideally, in an asthma attack which is severe, the reliever drug, that's the salbutamol or the albuterol, should be delivered with oxygen. However, this is not always possible, and it is used with a compressor pump instead, which pushes air through the nebulizer. So why am I telling you this? The disadvantage of using air to drive a nebulizer is that your blood oxygen level can drop quite low when used with air. The reason is that when the salbutamol reliever medicine is delivered by air, your blood level of oxygen falls because of a mismatch between where your blood flows in your lungs and where the inhaled oxygen in your lungs goes to. So you don't end up absorbing as much oxygen as you should. And so I come to the important messages about nebulizers. Firstly, nebulized reliever treatment is emergency treatment aimed at opening up your air passages that have tightened due to spasm of the air passage muscles during an asthma attack. However, it does not treat the underlying inflammation which is caused by asthma. For that, you need anti-inflammatory drugs, and that's corticosteroids, either inhaled or by oral tablets or by injection in severe cases. Secondly, because of two other risks, you should not be using a home nebulizer unless it's prescribed by an asthma specialist, because you have to have that treatment. You probably know what the two reasons are. One, that this is not the only way to treat an asthma attack. You also need anti-inflammatory treatment. And secondly, it is potentially dangerous, mainly because you will not have oxygen available at home to drive the nebulizer. And also because the reliever alone is not enough for treating the asthma attack. Sadly, I've been expert witness in 2 coroner's inquests where children have died from asthma, where they were using home nebulizers to treat their asthma. So the key messages from this podcast are: you should make sure that you know how to use your prescribed inhaler correctly. Ask your doctor or trained asthma nurse or pharmacist if they have been trained to check inhaler technique, and then ask them to check to see that you are doing this correctly. What you could do is get someone to video you using your inhaler with a mobile phone and show this to your doctor or nurse or pharmacist to see whether you're doing it correctly. Next, if you're using a pressurized meter-dose puffer inhaler, ask your doctor or trained asthma nurse if you need a spacer device to use with the inhaler, and make sure you know how to use that spacer. If you are prescribed a new inhaler or spacer, ask your health carer to check your self-management plan to include when to use this. In particular, this plan should include details of how to use the spacer with your reliever when you have an asthma flare-up or an attack. Next, nebulizers are for emergency use only, to give you reliever medication when you have an asthma attack. And nebulizers should ideally be driven with oxygen, especially if you're having a bad attack. They are not the only treatment for asthma, and they are only for emergency treatment, unless you've been advised by your specialist in asthma to use a nebulizer for delivering your asthma drugs. And to emphasize that last point, home nebulizers for relievers should only be used if they've been prescribed by an asthma specialist who is supervising you and monitoring your asthma control.